Every Tuesday about this time we do our injury update powered by the Sports Institute at TSAOG Orthopaedics and Spine online at TSAOG.com. A guy that's never in the doghouse. Dr. Eloy Ochoa joining us now on the Buyers Barricades guest line. Doc, how's your Tuesday?
Not too shabby. How about you guys?
Doing well. Recovering from Super Bowl week last week.
Yeah.
Question for you. Spurs have added De'Aaron Fox, and apparently he's been dealing with a ligament injury in his shooting hand, and he said the other day he's probably going to have off-season surgery. What could he be dealing with where he can play like he's playing now, which is great, but still need to get some surgery done in the off-season?
Well, I mean, what it looks like, because he's got a couple of injuries, it looks like, on that shooting hand. One's a little bit more recent to the thumb. The other one is the one that happened a little bit further back. It was a dislocation of the pinky, it sounds like. And obviously, basketball players, it's a really common injury, catching passes or rebounds or what have you, people kind of trying to get balls out of your hand. Typically, that's the joint. So there's three joints in that finger. There's the knuckle, the big knuckle that's closer to the hand. And then there's a little joint out towards the tip. Well, this is the one in the middle that dislocates usually. And typically when it dislocates and pops back in, or they have to pop it back in, you'll tear the capsule that surrounds the joint. And on each side of the joint, kind of like on your knee, there's these little collateral ligaments. And usually the collateral ligaments won't peel a piece of bone off, but the capsule will underneath. And you'll get a little fleck of bone that can be pulled off sometimes. And I think that's what they're talking about. Sometimes if there's continued discomfort there or problems, they can clean up some of those little bone spurs and clean out the joint a little bit. It's not a typical thing, I wouldn't say. A lot more common, if you have a real bad ligament injury on the thumb than on the pinky with these dislocations, because the dislocations are very common, and usually just doing what he's doing, which is buddy taping and letting it heal, is good enough.
Well, it must not bother him too much. He's been playing pretty well and shooting the basketball pretty well. Is that something major? Is that going to take him a while to recover from if he indeed has surgery in the offseason?
No, I don't think so. I think, and once again, especially if it's that, even if it's the shooting hand, that pinky, doesn't play a huge role in the shooting. That's why he's functioning with it buddy taped to the ring finger right now.
All right, so that works out pretty good.
Yeah, it does.
And that trade is working out a lot better for the Spurs than, say, Anthony Davis showing up in a Mavericks uniform and getting hurt in his debut with an abductor issue. What's going on with AD?
Yeah, I think it was an adductor issue, actually, but it may have been an abductor. Yeah, it was an adductor, so that's still kind of in the groin area.
Oh.
It's the one that kind of brings the leg inwards, and it's a really bad injury for anybody who has to do any, shifting laterally or start and stop quickly like you do playing basketball or football or those kinds of activities. And I don't know the extent of the injury. Obviously with an MRI, there's different extents to it. Sometimes it's just a partial strain of the muscle or the tendon where it attaches to the pelvis. And sometimes you can have a full tear where that tendon where it attaches to the pelvis completely detaches. And 20 years ago, we treated those all without surgery and just let them heal, but they can take several months to get better. And there's re-aggravation pretty commonly now. Those big avulsions that I was describing where the whole tendon pulls off the bone, lately they've been treating those like the hamstring tendon avulsions where they actually go and repair it back to the pelvis, but they haven't mentioned anything about surgery site. Maybe that's the case where it didn't really completely pull off the pelvis.
Does age have anything to do with that, Doc, in the recovery? I mean, Anthony Davis in his early 30s, does that matter?
Yeah. No, 100%. I think combination of age. He's obviously a bigger guy as well. And, the recovery is a little tougher as you get older. And these guys put a lot of stress on those tendons because they've got long lever arms with those legs. So, I think they all play factors. And he's had some issues through his career.
Yeah,
They're all different injuries, but he's not a spring chicken anymore, that's for sure.
No, which makes that trade even more and more confusing. Dr. Eloy Ochoa, always appreciate the knowledge and insight. The injury update powered by the Sports Institute at TSAOG Orthopaedics and Spine, online at TSAOG.com.